Hi, my name is Chris Brunson, and I'm the founder of PEC 360 and the Patient Engagement Center model for proactive healthcare delivery. So why did I start PEC 360? Well, for some context, let me share my background. Well, I've been in healthcare since 2009. I have no clinical training, and I don't have a master's in health administration. But what I do have is 20 years experience in the most competitive consumer retail industry on the planet, the retail automobile business. Before PEC 360, I was a third-generation car dealer. I spent 20 years as an owner-operator of multiple General Motors franchises. So what does an ex-car dealer have to offer healthcare? Well, because automotive retail is so hyper-competitive, it produced a business process that transformed the retail automotive industry in just a 5-year period, and I had a front row seat for it. This business process came to be known as the Business Development Center, or BDC. In simple terms, a BDC is an outbound call center in a car dealership that's purpose is to proactively schedule sales and service appointments for both new and existing customers. The establishment of a BDC transitions businesses from reactive, where you hope customers show up, to proactive, where you take control of your financial destiny by proactively engaging your customers to generate business. To do this, a BDC leverages what's commonly known as Customer Relationship Management Software, or CRM. Today, most businesses that are not proactively managing and engaging their customers will soon find their competition is doing it for them. So back to healthcare. In 2011, I was asked to create a healthcare version of a BDC for a large group of primary care doctors. The original goal was to proactively schedule new patients for marketing efforts and to schedule existing patients who were past due for a visit or procedure. That's when I got the shock of a lifetime. I discovered that 45% of all patients are non-adherent with their physician's recommended care plan and are due for a visit or procedure today. I couldn't believe it. The New England Journal of Medicine reports, and PEC 360 has now confirmed many times over, that 45% of all patients are past due for a physician-recommended visit or procedure. What an opportunity to improve the health and well-being of so many people, not to mention the financial well-being of healthcare organizations. Think about it. 45% of a healthcare organization's customers, i.e. patients, need their service today, but they have no mechanism to identify and schedule these patients. Thus, the Patient Engagement Center model for proactive healthcare delivery was born. So who are these 45%? Well, they're you and me. Many of these visits are disease management or preventive care in nature, meaning the patient doesn't currently feel sick. Think diabetes checkups, mammograms, colonoscopies, etc. So the trick is, how do we get these patients who don't currently feel sick to proactively seek the care they need? Well, to accomplish this, we must first identify these patients with gaps in care and then create a healthcare sales team, i.e. Patient Engagement Center, to convince these patients to schedule their visit or procedure. Because left unperformed, this leads to serious acute issues that are both costly and terribly debilitating for patients, and can lead to death. When it's said here in the U.S. that we treat illness, not wellness, this is what they mean. PEC 360's goal is to change this dynamic by supporting healthcare organizations in their transition from reactive to proactive healthcare delivery. We envision a world where every healthcare organization has a patient engagement center that proactively communicates with each of their patients to ensure they receive the right care at the right time and in the right care setting. That's why I created PEC 360 and the Patient Engagement Center model for proactive healthcare delivery.